So we'd like to kick today off by wishing a very happy birthday to the Affordable Care Act. The ACA turns 11 today. And this historic law dramatically changed the health coverage landscape in America. And for over a decade now, the ACA has made health coverage and health care more affordable and accessible for millions of people nationwide. 2 weeks ago, the Biden administration signed into law the American Rescue Plan Act, which includes provisions that build on the ACA and make health coverage even more affordable. These new policies will open the door to millions of uninsured people who were previously priced out of the marketplace. During today's town hall, we'll dive into the provisions of the American Rescue Plan Act that impact health insurance. We'll also discuss how COVID-19 testing, treatment, and vaccines are covered under different types of health coverage. And we'll provide a brief update on public charge. Today's speakers here at the Center on Budget and Policy Priorities are Tara Straw, Senior Policy Analyst, Jenny Sullivan, Director of Housing and Health Integration, Shelby Gonzalez, Director of Immigration Policy, Jen Wagner, Director of Medicaid Eligibility and Enrollment, and Sarah Leek, Senior Policy Analyst. Now we'll turn it over to Tara to get us started.
Great, thank you, Ina. So we've got a lot to talk about, and we are going to race through, but we're providing these slides and a lot of detail on the slides, so you can use them as a reference. And as Ina said, we're happy to take some questions here, and I'm sure you'll have more questions than we have time for, so you can email us and we'll put together a new resource that answers some of these questions in more depth. As you all know, we're in the middle of a special enrollment period. It runs through May 15th. For HealthCare.gov, and some state-based marketplaces have their own special enrollment periods, but they often have different deadlines and different rules. People can newly enroll, or existing enrollees can change plans, but you have to use some caution if you're going to change plans. So here are the basic rules. When selecting the same plan within the same year, out-of-pocket spending should carry over. So if you're just selecting the same plan, your out-of-pocket spending will carry over. But if you're changing to a new CSR level of the same plan, out-of-pocket spending should carry over, but it's not clear that all insurers apply this the same way, so you'll need to talk to the insurer. If you're changing to a new plan with the same carrier, out-of-pocket spending isn't required to carry over. So again, talk to your insurer because some may have different rules. And of course, if you change to a new carrier, the enrollee is going to lose credit for any money paid toward deductibles or other cost sharing. And there's also a special rule on effective dates. Coverage is effective on the first day of the following month, regardless of when someone enrolls. So normally someone will be, for instance, if they enroll on March 16th, they wouldn't have coverage effective until May 1st, but that actually isn't the case during this SEP. Someone who enrolls on March 31st would have coverage effective April 1st. So we're going to go over the main provisions of the American Rescue Plan Act, the health provisions. First of all, the biggest thing to note is that there's higher Aptc, which means lower premiums, and it's across the board for 2021 and 2022. People with income up to 150% of the poverty line will be eligible for a zero premium benchmark plan after their Aptc. People with income over 400% are newly eligible for Aptc. And again, these two are for 2021 and 2022. People who receive UI benefits, unemployment benefits, are eligible for a zero premium plan after Aptc with the highest CSRs. And this is regardless of projected or actual annual income. And this is for 2021 only. We'll do examples of all of these so you can see how they work. The Cobra subsidy, 100% of the Cobra premium is subsidized, but only for some months this year. And there's repayment forgiveness. So the Aptc repayment will be forgiven for 2020 only, which is the tax returns people are filing right now. So you can see there's a dramatic reduction in premiums. Premiums will decrease an average of $50 per person per month. And over 50% of people, up from only 14% of people before, will be able to find a silver plan for less than $10, for $10 or less a month. And we're going to see some of this stuff in action in just a minute. Implementation. Everyone has a lot of questions in implementation. Thanks for submitting some questions early. At HealthCare.gov, existing enrollees will have to return to the application after April 1st to see upfront savings. So these premium discounts will not be automatic. In the application, you're going to go through just like any normal step. You're going to report a life change, and then you have to click through the application, get a new eligibility determination. And of course, throughout the way, you're going to confirm that all information is correct. Some people may have changes of income projections that are different from the income projections they made, say, in November. The earliest the lower premium can take effect is May, on the May billing cycle. If someone doesn't return to the marketplace, they'll still get the additional premium tax credit, but it'll be on their tax return, and it'll go back to January 1st, 2021. New enrollees should enroll during the existing special enrollment period, which ends May 15th, and we'll see upfront savings. The higher Aptc for people approved for UI will take longer to implement, but people should enroll now if they can afford to do so. Because remember, they'll get that PTC back on their tax return and going back to January 1st. And so it's still very beneficial at tax time to enroll now. Again, implementation at state-based marketplaces will vary. Some states are going to require enrollees to return to the application, but others will automatically increase the Aptc. Some have special enrollment periods now, but again, their length and rules vary, so it's important to act soon. So here's an example. We're going to go through the major affordability provisions one by one. John is 27 years old. He has no affordable offer of employer-sponsored coverage, and this is important. The offers of affordable sponsored coverage are the affordability is measured, and the affordability standard has not changed. So even though the maximum premium someone is going to pay is 8.5% of income, the affordability standard for employer-sponsored coverage is still at 9.83% of income. So you can see pre-rescue plan, John would have been responsible for $646 a year in premiums, and with the rescue plan, he'll pay $0. That's his net premium, so he'll get the entire cost of the benchmark silver plan will be subsidized. People will, with income that's a little higher, will also see lower expected contributions. So in this example, we've got a family of 4, and you can see their ages there, no affordable offer of employer-sponsored coverage. We've got 2 kids in CHIP, and the adults are enrolling in marketplace coverage. At $60,000, they're in the uppermost CSR level. Their expected contribution is 7.57% of income. And you can see their Aptc will be over $1,000 for the month. But with the new law, that will shoot up to almost $1,300 a month. And you can see that the amount that they're paying per month is much lower. And their total savings on the year is really significant for a family of that income level. And newly, a new provision is that people with income over 400% of the poverty line will be eligible for subsidies. So here we've got Marcus. He's 60 years old, and this is going to primarily help people who are older. His income is $60,000. Right now, without a subsidy, he is paying 19% of his income toward health insurance, which even at that higher income level is not affordable for many people. But with the rescue plan, he'll be eligible for Aptc of over $500 a month. And so you'll see that he has really significant savings of over $6,000 a year. And of course, when you have the higher Aptc, you can go shopping with it. And so someone who has, let's say that Marcus, his income is $35,000 a year. His expected contribution would be $145 a month, and his Aptc is $800 a month. So of course, remember, when we establish the APTC based on the cost of the second lowest cost silver plan and the percent in the person's income, you can take that APTC and you can go shopping. So here you can see that Marcus, with his $800 APTC, can go buy a bronze plan and his APTC would be capped out at $733 because that's the premium. You can't get more APTC than your premium. Or he can, for $7 extra a month, he can get a gold plan, which with a much lower deductible using that higher APTC. And as I said, there are special benefits for people who are approved for or receive unemployment benefits this year. They're eligible for APTC as if their income is 133% of FPL. And just to clarify, I know that many of us talk about it as 138% of FPL as being the upper end of Medicaid, the lower end of receiving APTC. Technically in the law, it's 133%, so don't worry about that discrepancy. Income of 133% FPL applies to the entire family for the year, even if projected or actual income is higher. People in the coverage gap are deemed to be eligible taxpayers and they can get APTC. So this is important for those of you in coverage gap states. There will be a new group of people, those who receive unemployment benefits, who are newly eligible for APTC, and we need to find those folks. People with affordable offers of employer coverage are still barred from receiving APTC, so that hasn't changed. The employer rule is still there. It's unclear what verification HealthCare.gov might require, and certainly what the state-based marketplaces might require. I'll give you just the language from the law. It says self-attestation and such documentation as the secretary shall prescribe, which demonstrates such receipt or approval of unemployment benefits. So we are still waiting to hear what such documentation the secretary shall prescribe. And here's an example. We've got Jean, Son, and Dave and their 2 kids. The kids are in CHIP. Jean, Son, and Dave are looking for coverage. Jean, Son was approved for unemployment benefits in January 2021, but she expects to return to work in late spring. So their projected income is $5,000 in unemployment benefits, wages of $2,000 from Jean, Son after she goes back to work, and wages for Dave of $35,000. So a total family income of $60,000. So you can see that pre-rescue plan, their expected contribution would have been $379 a month, or more than 7.5% of their income. And that would have been for a plan with an AV of 73%, since they're between 200 and 250% of the poverty line. And of course, the lower the AV, the higher the deductibles. But with the rescue plan, their income is set at 133% of the poverty line. That means they're eligible for a 0 premium benchmark silver plan with an AV of 94%. So you can see someone with unemployment benefits is really getting a rich deal here. And this is regardless of the rest of their income. And they're going to get that now and or when they reconcile on their tax return. So it's not use it or lose it, just like any other aspect of the premium tax credit or the premium tax credit for any other income level. So if they don't get the benefit now, they will get the benefit of at least the PTC on their tax return. But of course, the cost sharing benefit is very valuable as well. So let's change the scenario here and say that they are in a non-expansion state and that they have income that is below the poverty line and that puts them in the coverage gap. So they would be expected to pay the full premium, which of course, most people can't afford to do. So, so they would be stuck without insurance. But under this new provision, in the rescue plan, they would actually be lifted out of the coverage gap because Jane Sun has unemployment earnings. And so they would pay $0 a month, no premium for a benchmark silver plan, and they'd get the higher AB. So that was our whirlwind tour of the premium tax credit improvements. And now we're going to talk a little bit about Cobra, which we've gotten many questions on. Cobra is fully subsidized April 1st through September 30th for people whose qualifying event was involuntary loss of employment or reduction in hours worked. So, you know, there are other ways that you can qualify for Cobra, things such as divorce. But in this case, Cobra, the subsidy is only available under certain conditions. So involuntary loss of employment or reduction in hours worked. The Cobra subsidy is going to be administered by employers who are supposed to provide a notice to employees, but of course the law just passed. So they are a little behind on that, I'm sure. Employers pay the Cobra premium upfront on behalf of their eligible individual enrollees, and versus giving the money directly to the enrollee. People should contact their employers or their benefit administrators to enroll. So the plan itself probably won't be able to help you unless it's a self-insured plan, in which case it might be the benefit administrator that can help. People who didn't elect to enroll in Cobra previously are eligible to enroll now. So it's not as though you need to have continuous enrollment from the time of your separation from employment or reduction in work hours to get this benefit. So if a person was laid off in July 2020, they still have time to elect Cobra. The dates related to Cobra and the Cobra eligibility period, election period, these are all really complicated, so we're taking a really light touch on them. Normally, Cobra coverage applies retroactively to the qualifying event, and the first premium applies back to that date. So you have to catch up on all premiums if you're going to elect late under these special COVID rules. But under the rescue plan, these late electors who are subsidy eligible will have Cobra and premiums take effect on April 1st. So there's no back premiums are required to enroll and get this subsidy. If you exhaust before September, so you come to the end of your 18-month benefit window, or in some cases a little longer than 18 months, then the subsidy ends when Cobra ends. So we'll do an example of this and just demonstrate the difficult decision that some people will need to make, and you'll need to help them make. So Kayla lost her job and her health insurance in June 2020. She couldn't afford Cobra. She was approved for unemployment benefits in July 2020, and those benefits continued until January 2021. She started working part-time in February. She's not offered affordable employer coverage. She enrolled at HealthCare.gov for coverage that started January 1st, and as you'll see in her selection of choices, her projected income doesn't matter. Why? So she is enrolled in Marketplace, or she can enroll during this special enrollment period, and she'll be able to get the benchmark plan for no premium after Aptc. And that's because she was eligible, or she was enrolled and approved for unemployment benefits at some point in 2021. It doesn't have to be every month. It doesn't have to be a whole month. It could be a single week in 2021, and she's eligible for the entire year for this no premium benchmark plan. Or she could choose to enroll in Cobra, the subsidized Cobra. So she also would be paying no premium after the subsidy for at least until September 30th. So there are a lot of things that she needs to consider, and we just have a couple of them here. So one of the chief ones that people are going to think about is the deductible. If she's already enrolled in Marketplace coverage, has she started paying toward her deductible? If she elects Cobra, she'd have to restart the deductible. If she went back to the Marketplace, she might be starting the deductible again, depending on what plan she chooses. And there's a big question of whether she would be eligible for an SEP to buy marketplace coverage after Cobra eligibility ends. So sorry, after a Cobra subsidy ends. This is an open question. I think the answer is going to be yes, she's eligible for a SEP, but I can't promise you that's the answer. As soon as we do see a definitive answer, we will let you know. And finally, there is another provision that's related to the premium tax credit calculations on the tax year 2020 returns. Again, these are the ones people are filing right now. There are two factors that are going to affect the calculation of the premium tax credit on these returns. One is an income disregard of $10,200 in unemployment benefits. So that's subtracting out the first $10,000 or so of unemployment benefits. This is going to lower income and it will raise the premium tax credit. This is only for 2020, so don't get confused and think that in income projections for 2021, we're going to be doing that subtraction. We're not. This is only looking backwards at 2020. There's also repayment forgiveness. So for 2020 only, the repayment of excess PTC for any reason is forgiven. So if someone's income went over 400% of the poverty line, or if someone was married filing separately, or any of the other reasons that people can owe back premium tax credits, that's going to be forgiven for this 1 year only. There aren't a lot of implementation details yet, but the guidance from the IRS has been that if someone has filed a tax return already, do not file an amended return yet, so hold your horses. And, you know, tax preparers know, I hope, never manipulate the entry of forms to get the right answer. So you wouldn't want people who are kind of anxious to get their benefit to try to fudge with the forms in order to get the answer they think that they're entitled to get. So I think with that, we can open it up for questions.
Thanks, Tara. So as Tara said, a lot of the implementation details aren't available yet. So a lot of people have asked about implementation, so we won't be able to answer some of the specifics, but we'll try to answer as many as we can. So on Cobra, if someone has an option for a $0 premium Cobra coverage now, are they still able to choose a marketplace plan instead of Cobra?
Yes. So people are allowed to select a marketplace plan instead of Cobra, assuming they're otherwise eligible for the marketplace plan. Yes.
And will the application be able to process the UI changes in income as of April 1st?
Good point. No. The UI change isn't going to happen until sometime this summer.
Will the C plans tool on HealthCare.gov be updated to show these new changes, or when can we expect the update to happen?
You know, I'm not positive. I would certainly hope that by April 1st, they would update that tool as well. But I know they're working so hard on the application and trying to get the eligibility determination system to spit out the right answer that it's possible some things may fall behind, but we're certainly hopeful that they'll get that updated.
And if someone receives just 1 month of unemployment, are they deemed eligible if they are in the coverage gap?
Yes. So any month of unemployment or any approval for unemployment, it could be a week, and you are still deemed to have income that is 133% of the poverty line. And so someone who is in the coverage gap can not only get out of the coverage gap and be eligible for Aptc, but can also get a generous cost sharing reduction.
And when someone's subsidized Cobra coverage ends in September, are they able to receive an SEP to enroll in the marketplace?
Yeah, and as I said back on that slide, we're not 100% sure. I can make a good case that they should get that they should be eligible for an SEP to enroll in marketplace coverage, but the agency hasn't said one way or another whether my interpretation and the interpretation of many is correct, and so stay tuned.
Can someone choose to leave Cobra and choose a marketplace plan during the current SEP?
Yes. So as long as we're in the SEP period, you can decide to leave your Cobra coverage and get into marketplace coverage.
If someone receives unemployment benefits, but then receives an offer of affordable employer-sponsored insurance later in the year, can they stay in their marketplace plan with high subsidies?
No, the affordable offer of employer-sponsored coverage makes them ineligible for subsidies. So that restriction hasn't gone away.
And if an individual's unemployment benefits ended on the 31st of December and they don't receive them in 2021, is the zero premium option still available to them?
No, not for the purpose of the unemployment, not for the unemployment portion. Of course, if they had income that was 150% of poverty, 100% of poverty to 150%, they would be eligible for a zero premium silver plan under the other provision. But if they're not receiving unemployment benefits in 2021, they're not eligible for that benefit.
Do the increased Aptcs date back to January 1st? And when will people receive a refund for the January through April period?
Yes and yes.
Okay. Let's see. And for their Aptc repayment forgiveness, if an individual has already filed their taxes and paid back tax credits, how can they receive the forgiveness of their Aptcs?
Yeah, that's a good question that has not been answered yet. So there are a couple of options for the IRS. And again, this has not been answered yet. This is me speculating, as I like to do. But it might be that they'll be required to file an amended return and then they would get their refund at that point. Or perhaps there's some kind of magic the IRS is going to do behind the scenes to make that correction. But it's not clear yet. So as soon as we have details, we'll let you know.
And if someone is currently enrolled in a 2020 plan with a premium subsidy, do they need to re-enroll in the same plan to receive the higher subsidy?
They do not need to enroll in the same plan to receive the higher subsidy. However, remember what we talked about at the beginning regarding cost sharing. And so if they've already paid a certain amount of money out of pocket, the question is, it might be more beneficial for them to stay in the same plan so they don't lose that money. And then there's some gray area where they may or may not lose that out-of-pocket contribution. And then if they change carriers altogether, they will certainly lose that out-of-pocket contribution. So they don't have to stay in the same plan, but in some cases, they may really benefit from staying in the same plan.
When the UI change is implemented in the summer, what will happen to people who had a silver plan and their CSR improves and they have already exceeded their deductible?
That's a good question, and that's a complicated one that we can't entirely answer. And the first reason for that is because we're not 100% sure, or the marketplace hasn't announced that when the unemployment fix is implemented, that people will get an SEP for that. You would have to assume that they would have to let people, come in and change their plans or newly enroll when they have that fix implemented. But they haven't said that, and so we can't say that for sure. And then the question, questions related to deductibles really will need to go through the carrier. I don't want to say one will. I think that if you're in the same plan and you're just switching between different CSR levels, then that deductible should carry over. But if you've already paid in excess of the new deductible, I don't think you see the benefit of that. Sarah, if you're available, is that correct, or am I bungling that?
Sorry, I didn't hear the whole question.
The question is if someone switches CSR levels and they're switching up to a gold plan, for instance, and they have paid, they've paid in excess of the gold plan deductible, they don't see the benefit of the, it goes toward their out-of-pocket maximum, but it's not as though the insurance company writes them a check.
You're guaranteed only, first of all, only if you stay with the same plan that you're in. So if you're jumping metal levels, that's one issue where you're not guaranteed to get credit for that. If you are staying with the same plan, meaning you're in a silver plan and you're moving metal, you're moving CSR levels, you will get credit, but you don't get excess. So if you've paid more, you're not going to get a check. That's right.
Thank you.
Regarding repayment forgiveness, if someone receives more or excess APTC this year, will they have to repay the APTC next year?
No, this is flat out full forgiveness for 2020. But remember, this is just for 2020, so people should be as accurate as possible for the entire year for 2021, because don't expect this repayment forgiveness to come back again in 2021.
And do we have information about what kind of life change people need to report in order to get the enhanced APTCs?
That's a really good question. And no, we don't. We don't have information. I think that, well, I shouldn't speculate too much. We don't have that information. I think that once you report any of the life changes, you'll have an opportunity to page through your application again and make changes or not make changes. So I think that's the case, but what we know is there's not going to be some special button that you push and then you get the new APTC determination. So you're going to need to go through the screens as you know them. We're not expecting anything new to happen in the application screens.
If someone is reading UI and is eligible for Medicaid, will they still be eligible for the zero premium plan?
No. So if you're eligible for Medicaid, then you will still be expected to go into Medicaid.
Great. So we will pause again at the end of the presentation for Q&A, but for now we'll turn it over to Jenny for her presentation on COVID-19 treatment, vaccines, and testing.
Great, thanks, Ina. So in addition to these coverage provisions that Tara has walked through, the American Rescue Plan Act also made several changes to improve access to COVID-19 testing, vaccines, and treatment. I'll focus on the protections in place by coverage type in just a moment, but first I wanted to note that the Rescue Plan also made deep investments in community health centers, state, local, tribal, and territorial health departments, and the public health workforce to bolster vaccine rollout. It also created a new tranche of provider relief funding specifically for healthcare providers in rural areas. Now let's talk about testing, vaccines, and treatment coverage, starting with Medicaid. So testing, vaccines, and treatment services must be covered in Medicaid without cost sharing requirements for full benefit Medicaid enrollees. The Rescue Plan doubled down on vaccine coverage, requiring it be covered without cost sharing for all Medicaid enrollees, even those in limited benefit categories such as family planning. The federal government is paying the full cost of vaccinations for all Medicaid enrollees. States have also had the option since the Families First law was enacted last year to create a special Medicaid COVID-19 category to pay for testing for people who are otherwise uninsured or who are underinsured, regardless of income. The Rescue Plan adds coverage for vaccines and treatment to this category, making this option much more robust. The federal government pays for the full cost of this category, including for administrative expenses like adjusting eligibility systems to account for it. 16 states had adopted it when it was covering testing only. We expect, because it has been made so much more generous, that additional states may take advantage of it now. And I'll go ahead and put in the chat box right now which states those are to spare you me reading all of those off. There you go. So these Medicaid provisions all remain in effect until more than a year after the public health emergency ends. That was another important provision in the rescue plan. So that means through the end of the first quarter that begins 1 year after the end of the public health emergency. I know that's a little complicated, but basically, let me translate it for you. The administration has said that the public health emergency will remain in effect at least through the end of this calendar year, which means that the provisions that I've just talked about in Medicaid would remain in effect until the end of the first quarter of 2023. Now let's move to the uninsured. Next slide. So people who are uninsured, including people in the Medicaid coverage gap, can get coverage for testing, vaccines, and treatment through the Medicaid option I just described, as long as they have eligible immigration status. But the way the category has been broadened may also increase availability of emergency Medicaid for some immigrants. Remember, immigrants who have not been in the country for 5 years or who otherwise lack eligible immigration status can qualify for federal payment for emergency conditions if they would qualify for Medicaid, but for their immigration status. So if a state adopts the Medicaid COVID-19 category, immigrants who would qualify for it, but for their immigration status, including people with incomes higher than a state's regular Medicaid income eligibility limit, may be able to get emergency Medicaid for COVID-19 testing and treatment related services. In states that have not taken up the Medicaid category, providers can claim reimbursement for testing, vaccinations, and treatment provided to people who are uninsured, regardless of immigration status, through Hersa's uninsured program, funded through the larger federal provider relief fund. Providers are not allowed to balance bill patients if they submit claims through this category. Then finally, last slide, private coverage. So non-grandfathered and individual market plans, including qualified health plans through the marketplace, must cover COVID-19 testing and vaccinations without cost sharing and without requiring someone to first meet a deductible or obtain prior authorization. These services must be covered regardless of provider network. However, no special provisions are in place for treatment services. Treatment remains subject to a plan's regular cost sharing requirements. Grandfathered plans must also cover testing without cost sharing and regardless of provider network, but these plans are not required to cover vaccinations. Finally, short-term limited duration plans are not required to cover testing or vaccines. People enrolled in these plans are counted as uninsured and so could be covered through their state's Medicaid COVID-19 category if the state has adopted it, or providers could claim reimbursement through the Hersa COVID-19 uninsured program. These provisions for private coverage remain in place through the end of the public health emergency, but not that longer period that I described for the Medicaid provisions. And that covers it, but happy to answer any questions folks might have. Thanks. Ina?
Thanks. We're actually going to turn it over to Shelby now for an update on public charge. Take it away, Shelby.
Great, thank you. So I have great news to share on the public charge front. As many of you all know, public charge is a policy, it's an assessment that individuals go through when they're trying to either adjust their immigration status here in the US or they're trying to come into the US. And over the last several years, there was movement towards creating a new set of rules around public charge that really made it quite frightening for a lot of families to that wanted to either have a family member come or they themselves come or adjust their status in the US. There was a lot of confusion around the Trump administration's rules and changes on public charge. And because it was so scary to people, a lot of people just did without accessing really important benefits, including health coverage, including benefit programs like ACA that wasn't even factored into the public charge rule. The good news is that those rules are no longer in effect across the country. There was some court activity, really important court activity that ended up happening. And as a result of all of that, the rule has been blocked. The rule that was put in place in 2019 has been blocked from being implemented. and we will, and the Department of Homeland Security has stopped utilizing and implementing those rules and making assessments. So that's great news. And so what does that mean from a policy perspective? When somebody goes through a public charge assessment, and one of the key things that is important to remember is that not a lot of people do go through public charge assessments. It's really only the individual, whether or not they themselves have to change their status. Like maybe I'm somebody who has temporary protected status in the country, and now I want to become a lawful permanent resident. That's an example of somebody who goes through a public charge assessment. If I go through a public charge assessment, they're going to be looking at my use of benefit programs, not the use of my children's benefit programs, not the use of my parents or anybody else. It's my use of public benefit programs that are going to be taken into account. And under these rules that have been in place since well, they've been in place even longer than this, but in 1999 there was guidance that was issued by what is now called the USCIS within the Department of Homeland Security. And what they are looking at is the use of cash assistance from the government, and that can be federal or state funded cash assistance for ongoing maintenance, not a one-time, you had an emergency and we're going to pay your, pay bills, or not a one-time, we have an emergency, we're going to let you help you get by for this one specific time period. This is for ongoing maintenance, so more on a regular basis, like you're getting a check for your sustenance, to sustain your family or to sustain yourself. So cash assistance from the government, and long-term care paid for at the government's expense. And what we mean by long-term care in a facility, it's like an individual who might be in a nursing home type of situation, and the government is paying for that. Maybe oftentimes that's done through Medicaid. So this is, that doesn't mean like you went to a rehabilitation center for a week because you had hip surgery, and that's not what we're talking about here. We're talking about institutional care for long-term care. So all of this is to say is that the rules are far more narrow, and it's going to be, it's good so that people are better able to understand that this is not them. They should not be freaked out about accessing benefit programs like Medicaid or the Affordable Care Act subsidies or CHIP or SNAP or housing assistance because of what might happen later on to them or their family members in a public charge assessment. So we're really thrilled to be able to tell you this great news, and glad to answer any questions if you have it. The one thing I will say, the last thing, is that a lot of outreach is needed here. And we know that you all are trusted in your communities, and getting good information out and letting people know it's going to really help, because there was such a huge steady drumbeat about these rules when they were being created and thought about and finalized. Now we need to have a big drumbeat to let people know that these rules are gone and that it is safe for them to apply for benefit programs so that they can weather the storm. So thank you all, and I'm glad to answer any questions. Thanks, Zena.
Thank you so much, Shelby and Jenny. So we have time to take some more questions, so please keep them coming. We will start with I think Tara covered this, but just to reiterate, when will the lower premiums be visible on HealthCare.gov?
The lower premiums will be visible as of April 1st, but the UI provision won't be implemented until the summer.
And will the entire household be eligible for a $0 premium plan if only one member receives UI in 2021?
Yes, unless, and we've gotten this question a number of times in the chat, unless there's an offer of affordable employer-sponsored coverage. So the amount of the Aptc under all of these provisions has changed, and Aptc is higher in all cases. But remember that the other rules are still in play. So you can't be married filing separately. you can't have an affordable offer of employer-sponsored coverage. So those rules remain in place.
And let's see, can an existing applicant update the application to have more APTC after May 15th, after the SEP deadline?
That's a good question. I think they can update their application to report a change, but cannot change plans. I think that's the case, but we'll have to double check.
And will someone who doesn't make enough to obtain a tax credit be able to enroll in a plan?
That's a pen. So if I'm understanding the question correctly, someone is either in Medicaid or in the coverage gap, probably in the coverage gap, so they don't make enough money to get APTC. Can they enroll in a plan? Well, right now during the SEP, they can enroll in a plan if they can afford it. But right now, for instance, the special unemployment benefit that we talked about that applies to people who are in the coverage gap, that isn't operational yet, so they would not be able to get APTC for that reason.
And is the cost sharing benefit that comes with UI applied retroactively to out-of-pocket expenses that occurred before the plan was notified of the UI, additional UI benefits?
I don't think, Sarah, do you want to take this one? I don't think so.
Yeah, I don't think so. In HealthCare.gov, there has been some question about whether that would be universally the case, but yeah, there's no real way to apply cost sharing assistance retroactively.
And will consumers with actual income over 400% now have a limit on the amount they have to pay back?
No. The repayment, so remember, I'm talking about 2021 and going in 2022. The repayment table has not changed, but remember that, we have this cliff right now where if someone goes over 400%, they owe everything back. Well, now if someone goes over 400% or gets to 500% or 600%, they would only owe that marginal amount back. So there aren't the same sort of dire cliffs that we have had in the past.
And a really obvious question that I don't know if we have the answer to: are consumers notified of all of these changes by the marketplace? And if so, how?
Well, we hope the marketplace is going to get the word out. I have a lot of faith that the marketplace is going to get the word out. They're doing a $50 million ad and marketing campaign right now related to the special enrollment period. And we certainly hope that some messages will be included about the enhanced APTC. What we don't know is if individuals will be contacted. So will all marketplace recipients, all marketplace enrollees get a letter by mail? Will they get an email? Will they get 700 emails? We are not sure about that yet.
And this next question is for Jenny. Can you please clarify whether people without a legal status can receive a free vaccination?
So that actually, it's a very logical question, but it sort of goes beyond the scope of the coverage provisions I was covering. They should not be checking an individual's or requiring any documentation of citizenship status if the vaccine is being administered. However, there are lots of other things one has to do, and different states and localities have different rules about obviously who can get vaccines when and where and under what circumstances. And so I don't want to oversimplify it and say absolutely yes.
Thank you. And this next question is for Shelby. You mentioned that public charge will affect those who have Medicaid in the long term. And I think this might be a misunderstanding, but how long term? Is it 6 months or a year? I'll turn it over to Shelby for this question.
Hi. when we talk about long-term care, it's really only for individuals who are in an institution, living in that institution indefinitely, right? Like for at the government's expense. It's not for like a temporary short stay kind of situation.
Thanks, Shelby. Tara, this next question is for you. If someone files taxes as married filing separately, can they get the premium reduction too, since they are not eligible for tax credits due to their filing taxes separately?
So that's a good question. We've gotten variations on that question a couple of times in the chat. So thank you for asking. So the premium tax credit amounts have changed. So premium tax credits have gone up for 2021 and 2022, but the other rules have not gone away. So if someone is married filing separately, they cannot get the tax credit. If someone has an affordable offer of employer-sponsored coverage, they cannot get the tax credit. And that is true across, whether we're looking at just the PTC enhancements or whether we're looking at the UI provision. The other rules have not changed.
And are any of these provisions going to be in effect beyond 2022?
We hope so. There would need to be legislation for that to happen. And so, obviously it would be terrible to have this kind of benefit cliff where people are eligible for enhanced APTC now and then lose that, especially for people over 400% of the poverty line. And like we said in the examples, this primarily affects older people who can have really excessive premiums. So even if their income is higher than the typical enrollee, that doesn't mean they're not feeling it as far as the level of premiums they're paying. So we hope that these provisions will be extended.
And could you clarify whether anyone can qualify for APTC regardless of their income, including those who are over 400%?
It's not anyone because we still have the coverage gap. So it's not anyone, but it's people who are over 100% of the poverty line, and there's no upper limit on who can qualify for APTC. The exception is the people who are eligible or who are determined or who are approved for or receive unemployment benefits. In that case, people who are in the coverage gap can sort of be lifted out of it.
And do any of these changes change the eligibility for PTCs for people who are eligible for Kyceras or other HRAs?
That's a really good question. And you've struck upon my least favorite topic. I will just say that the other eligibility rules haven't changed. And that applies also to rules around Kyceras. And remember that part of the challenge on the ICRAs and the Kyceras is about there's a link to the employer to the employers to the affordability of employer-sponsored coverage, and that's part of the sort of the sticking point in the calculation there. And remember that percentage hasn't changed. It hasn't gone down to 8.5. It stays at 9.83%.
Next question is for Jenny. For immigrants who are undocumented, can they still get treatment for COVID-19?
So I'm going to flip that question a little bit and say that providers who provide treatment services to individuals who don't have coverage, and that would include individuals who don't have documentation, would be able to submit claims to the Hersa fund to get reimbursed for services provided to uninsured individuals.
Great. And another question for you. Was the Hersa fund program funded through the American Rescue Plan Act? And is there any information about the amount of funding still available and how long it'll be available for?
Sure. So the Hersa program is funded through the broader Provider Relief Fund, which has gotten money at a number of different junctures over the last year, including most recently in December, actually. The Rescue Plan Act doesn't add more money for this fund in particular, but there is a pretty up-to-date accounting of that. I'll put it in the chat box. It's the TAG system. It tracks government grants, and they've submitted or have paid out about $4.4 billion in claims so far for this program. The broader provider relief fund also channels funding to different kinds of providers through different pathways, and that one is 178 billion total, of which about just over 100 billion, if I said million, I meant billion, have been paid out.
Thank you. The next question is for Tara. Can you please reiterate the message regarding UI benefits and whether they may have the option to change plans after May 15th once the changes have been implemented on the marketplace?
I dodged on this one, so if you didn't get a clear answer, that's because we don't have a clear answer. So right now, and as of April 1st, the HealthCare.gov will still not be set up to deal with the special provisions related to people who receive unemployment benefits. I will say state-based marketplaces are on their own timeline. If you're in a state with a state-based marketplace, check in with them and see when that provision will be updated in the system. We can't say with certainty that people will be able to get an SEP to enroll once that provision is live in HealthCare.gov, but it's hard to imagine a scenario where they don't do that, because if they've made this such a big change, it's just hard to imagine a scenario where they don't let people take advantage of it. But having said that, it is not a guarantee.
And you mentioned that people over 400% FPL will now be eligible to get Aptcs. Is there a maximum income limit for Aptc cutoff?
No, there isn't. Although, of course, at some income level, your 8.5%, your premium is less than 8.5% of your income.
And we'll take one last question since we are at the hour. Do these changes apply to state-based marketplaces as well?
Yes, the increased Aptc it applies nationwide for 2021 and 2022. The UI benefit provision applies nationwide for 2021. The Cobra is nationwide, and the Aptc repayment forgiveness is nationwide.
Fantastic. Well, thank you so much to Shelby, Tara, Jenny, Jen, and Sarah. So as a reminder, we'll be distributing the materials from today's webinar via email, and we'll post everything to the Beyond the Basics website. If you have questions or need assistance, please feel free to reach out to us at beyondthebasics@cbpp.org. And with that, we'll bring today's webinar to a close. Thank you so much for joining us today, everyone.